Hi, I'm Ryan Nutter with Cornerstone Senior Advisors, and each day we walk people through the process of Medicare, helping them find the right plan to fit their needs at the right price. Today we're going to be discussing what are Medicare Supplement plans. What is a Medicare Supplement plan, also known as a Medigap plan, and why do you need one? So, Medicare Supplement plans, I have them listed out over here. These are Medicare Supplement, also known as Medigap plans. There's 10 of them. A, B, C, D, F, G, K, L, M, and N. These are 10 Medicare Supplement plans, and something that's important to understand about these plans is the government designed them. So what the government did is they designed 10 different plans and named them with letters, and they went to all these private insurance companies, and they said if you want to offer a supplement to Medicare, you can, but it's got to be one of these 10 plans. So they're basically telling them they can't make up their own supplemental insurance to Medicare. If they want to offer a Medicare supplement or a supplement to Medicare to help pay for things that Medicare doesn't, they can, but they have to pick from this list of 10 plans so they can decide which of these 10 plans they want to offer and how much premium they want to charge, because they're all going to charge different premiums. But as far as coverage goes, so for instance, a Plan G is very popular. This Plan G is a Plan G is a Plan G. It doesn't matter what company you go with, because none of these companies designed it. All they can decide is if they want to offer a Plan G, and if they do, how much premium do they want to charge. But as far as coverage goes, all these companies have to abide by the government's rules. So they have to pay the way the Plan G was designed to pay and cover what they were designed to cover. Now, why do you get a Medicare Supplement plan? For that, we're going to go over to this graph right here, this chart. So when we talk about Medicare, we're talking about two parts, Medicare Part A and Medicare Part B. This is original Medicare, and this is very much a bird's eye view at what's going on with Medicare, but just for this video to give you a little bit of a basic understanding, but this is Medicare over here, Part A and B of Medicare, and this is what Medicare pays. This is what Medicare covers, okay? Part A of Medicare is your hospitalization. So if you're admitted to a hospital, Part A is kicking in. This is what you pay if you don't have any supplemental insurance. If you just have Medicare, you don't have any Medicare supplemental insurance, this is your out-of-pocket exposure. This is what you're liable to. This is your out-of-pocket potential when you see a health professional. So Part A, you're admitted to a hospital. Day one, this is called your Part A deductible. So day one, you're admitted to a hospital. You have to pay $1,408. This will cover you for up to 60 days. The catch with this deductible is it's not annual. So if you're admitted to a hospital, you pay this $1,408. You're there 5 days, you go home. 2 months later, you're back in the hospital. You have to pay this deductible again. So you could pay that deductible several times in a year if it's a rough year for you. After 2 months in the hospital, now you have a per day copay of $352. If you're in there over 3 months, that 91st day you're in the hospital, that per day copay doubles to $704 per day. This is why you get a Medicare Supplement plan. Let's talk about coverage outside of the hospital. Part B of Medicare covers everything outside of the hospital. Primary care doctors, specialists, emergency rooms, outpatient surgeries, things like that. And with Part B of Medicare, there's a deductible of $198. This is different from your Part A deductible because it is annual. So you're just paying that one time a year. Once you pay this deductible, then Medicare is going to start kicking in. They're going to pay 80%, you're going to pay 20%. So what this means, anytime you go see a primary care doctor, you're paying 20%. Once this deductible is paid, you're paying 20% of that visit. Anytime you see a specialist, a heart doctor, a lung doctor, anytime you go to a physical therapist, if you end up with cancer and you're going in for chemo and radiation, you're paying 20% every time you go in for treatment. If you need an outpatient surgery, you go into the hospital, you have a procedure done, you go home the same day. If you're admitted, you're up here. But if it's outpatient, you go in, you have a procedure done, you go home the same day, you're down here, and you've got to pay 20% of that procedure. So that can become very costly. You can see, just from a bird's eye view, there's a lot of out-of-pocket potential, especially if it's a rough year health-wise for somebody on Medicare. This is why you get a Medicare Supplement plan, is to help you with these costs. Now, something else to note is with just original Medicare and no supplemental insurance, there is no max out-of-pocket. There's no ceiling. So if you do have a rough year health-wise, and the costs are building and growing, there's no end. There's no ceiling. There's no point where Medicare is going to shut your out-of-pocket costs off and say, you're not going to pay anything out of pocket the rest of the year. We've got it from here. That doesn't happen. So that's another reason, and one of the main ones, I would say, these are vitally important. So that you don't get left with, and it's not just for you, it's for your family. So you don't get left with very, very high out-of-pocket costs because you're needing treatment and needing care. These Medicare Supplement plans, there are 10. They vary. So this is something that you need a professional to walk you through and just explain what are the different coverages, what the different coverages look like, because a Plan C is different from a Plan F is different from a Plan G is different from a Plan N. They're all going to vary just a little bit on what they cover. And that's something we can work with you on, and we can educate you on, we can help you out with. We pride ourselves on just really educating our clients and walking you through the process, getting you to a point where you can really make an informed, educated decision that you feel very confident in. And we'd love to have the chance to do that. And if you would call us at 316-260-3331, we would love to assist you in working through this process. Try to figure out which of these supplemental plans you feel like is the best fit for you. And we can also look at every company out there, what premiums they're charging, what companies are offering each of these plans, and what premiums they're charging to help you figure out which route do you want to take, what plan do you want to go with, what company do you want to go with, and even help you get signed up. So call us today, 316-260-3331. Thank you.